Great. So I guess I'm mostly standing between you all and getting out of here. So I'll try to be quick about this. The first thing I want to do is give a thank you to the ONC staff who worked to put this meeting together. Having done this in my former life and run a bunch of these meetings, I know the incredible amount of work that goes into it. So for ONC folks who are in the room, I'm going to call your name. If you're here, you get to stand up. Fun for you. Yeah, so we can thank you for your work. So Rachel Abbey, Elise Anthony, Peter Ashkenaz, Andrea Jackson, Pete Kesey, Mark Nee, Mitch Kost, Mike Lipinski, who I think is on the phone, Beth Myers, Fatima Nassa, Steve Posnack, Max Saunders, Lee Stevens, and Gretchen Wyatt. They've been working really hard to try and make sure that everyone gets on the list and gets in the room and deal with folks on the phone and make sure everything runs smoothly. So we appreciate all of your work. And then also Lauren Ritchie and Joey who have set up the online tool that we're going to use for the comment process, which we'll get to in just a couple of minutes, as well as the administrative staff who escorted all of you in here this morning and some probably this afternoon as well. So we appreciate everyone taking the time to be here today online and in person. I know it's hard to find a whole chunk of day to come to something like this. Clearly by the level of attendance, this is important. And I think folks feel that way, which is good. And I think based on the presentations we had from folks, which thank you for doing that, I think it's clear that we've made progress, right? If we look back 5 years ago to where we are today, I think we can all agree that we've made some significant progress. Arguably though, there's still a lot left to get done. We don't have widespread interoperability. I think Cynthia's presentation made this very clear. She had gigantic binders of data for folks who are in her, that she's a caregiver for. Personally, the story I've been telling as of late is about my niece. So she, over the last year, has had a number of different health issues. Went to a particular hospital in the area that specializes in children to get a lot of tests done so they could try and figure out what's going on with her. And about 4 or 5 weeks ago, shortly after I started my new job, in fact, she had an emergency situation. And so everything was fine, but she wasn't feeling super great. And then in a Walmart parking lot, my niece just broke down crying because she was in such severe pain that she just didn't even know what to do with herself. She's only 6 years old. And my sister was trying to figure out what was going on and had no idea what was going on with her, but knew that something was wrong and she had to take her to the hospital. And when my sister was recounting to me the story of how all this went down, the one thing she said to me was, I had to take her to XYZ hospital because they had her medical records. And the hospital that's close to our house and close to where we were doesn't have them. And because she didn't know what was going on with her, that was part of her consideration. And my response to my sister was, that hurts because that means that I have failed you. It means our industry has failed you because you as a mom had to make a decision, not about expediency of care to get your child seen and taken care of, but where her medical records were. And that should just never have to be a consideration for a mom or a dad or any other caregiver. And so as long as that's the case, we need to continue to push hard towards interoperability and really advance where we're at. I think from all of the networks who are working on this, I think you guys deserve a round of applause for your hard work. This is not easy stuff. If it was, it would be done. It's not, which means it's hard and complex. And so we appreciate that work, but clearly there needs to be more work done to expand some of the use cases that folks are supporting, to build things into workflows better so that providers feel like the tools are right at their hands, to make sure that we can exchange not just for treatment, but for payment and operations and all the different things that we need to do to really shift our healthcare system towards more transformed care and value-based payment programs. So with that in mind, as we push forward on this work that Congress has asked us to do, we are opening up a 30-day public comment period, which I think you've heard folks comment on multiple times today. I'm going to see if I can make the clicker work. Yes, first try. All right, so as we open up the public comment period, we're going to use an online commenting system to try and be a little bit, well, good use of technology, frankly. And so we're using the JIRA system. If you've ever submitted something around clinical quality measures to ONC or CMS, it's the exact same system, same thing for the certification program. And what we're asking is that as you think about submitting comments, that you maybe think about categorizing some of the comments, frankly, to make it a little bit easier for us to go through them, because we anticipate there will be a lot. as you're submitting comments, what we want you to think through are what are the areas that really the networks have sort of solved and their agreements are the same. What are the areas where there's variation in their agreements? And I'll get to the 6 categories in a second, but where are the areas where there are things that are different that are problematic versus things that are different that are not, that we should either consider or not consider for the common agreement. So I think what we heard today, and this is fair, is that your use case sometimes affects the policies that are in your agreement. And so what are things that are use case specific that we should consider solved, we don't have to touch, we don't have to think about as we're thinking about a trust exchange framework and common agreement? What are the things that are not solved that we really need to turn our attention towards as an industry to get together and figure out how we fix it? And so as you think through that, we have these 6 categories. As we went over the different agreements that the different networks and trust frameworks have, there was a lot of commonality on some of the general principles in their agreements. And so what we tried to do was break down into about 6 kind of overarching policies or principles that a lot of these folks have. And so the first is standardization, and this is just talking about the use of standards, so whether it be IHE or HL7 fire specs or CCDA or what have you, there's a level of standardization that folks tend to focus on in their agreements. And so is there anything within that area we need to think about? Transparency, that exchange is conducted openly and transparently. I think we heard this a number of times today, goes hand in hand with accountability, consumers about how their data is being used. Third is cooperation and non-discrimination. So things like data reciprocity requirements and making sure that folks on a network are sharing with the person who's not their competitor, but they're totally unwilling to share with the person who is their competitor. What things do we need to think about there? Fourth, and I think we heard a ton about this today, is security and patient safety, which encapsulates not only things like encryption and identity proofing, authentication, authorization, but also from a patient safety perspective, things like patient matching, which I think we had a lot of comments about today. So what are the things that we should think about sort of within all of that area? The next one is access. So making sure that patients and their caregivers have easy access. So are there different policies that we need to think about that ensure that patients can, or their caregivers can actually use a network to get access to their data? And the last one is data-driven choice. And I think you'll hear Don talk about this. I think he's talked about it already this morning. It's the second use case in his list of use cases. And so the ability to really share data in bulk instead of single record by single record to folks who need to be able to look at that data to try and make better choices about the care. So whether that be a large employer or a payer, or even a patient or a caregiver who maybe has 6 people that they're trying to manage the care of. They might actually benefit from being able to get all 6 records at one time instead of having to go separately to get them. And then of course, there's a general comments category. So if your comments don't fit into one of these 6, I think it's 6, feel free to use the general comments category. And then the other thing to note, if you would like to submit a letter instead of comments into the JIRA system, we have an email address set up, which I think Lauren's going to go over in order to send those letters. There's just a security issue, and so for folks who want to do a letter instead of the comment, that's allowed as well. And then timeline. So we released the original blog post on July 3rd. Today is the 24th with our kickoff meeting. So in mid-September, we are having another listening session that will be a public webinar. We also have one other listening session that we'll have after the September one. We just don't have the date set for that yet, which is why it's not up here, but we've talked about that a little bit. And again, that public webinar will really be a lot more of a listening session. So today was a lot of presentations, but it's going to be really more like a town hall. Let's hear from all of you. And then sometime this winter, we will have a draft of the Trust Exchange Framework / Common Agreement out for public comment. It'll be our usual public comment process, which I think is 90 days. Is that correct? 60 days for public comment. And that'll be a chance for folks to submit written comments. And then we will, as Elise said, read every comment. And having done that on the interoperability roadmap, yes, we do read all of them. We will use those as input to the final version of the Trust Exchange Framework and Common Agreement, which will be released in 2018. that's sort of our general timeline that we have right now. Certainly things could change in there meeting-wise, particularly for the September meeting and the other listening session, but that's the timeline that we're working off of. That's pretty much all I have. I just want to thank everyone again for coming. I'm going to have Lauren come up. She's going to give you guys an overview of the online tool so folks feel comfortable using that, and we look forward to getting all of your comments submitted in. Thanks.
Okay, so I promise to be brief. I know it's been a long day, so I'll get to this fairly quickly. So shortly after the meeting, we will be emailing or sending out the link that you see here to the folks in the room and on the webinar and our other stakeholders as well. Just a reminder that this is a voluntary forum. You're not required to, but strongly encouraged. And of course, it will be 30 days, as we mentioned before. So if we could just click on the link, and we can bring up the forum. So here's the landing page, just some general text about the instructions. Also included here is the email address that Genevieve mentioned. So in that fourth paragraph there, it's exchange-framework@hhs.gov. So please feel free to send a letter or other attachment or other materials that you think would be helpful for us to consider. The comment areas here that you saw in the previous slide are also captured just as reference. I'll also mention that the slides from today will be posted on this page as well. So we'll add those shortly as well after the meeting. And then just click on submit a comment there. It's fairly straightforward. We've tried to make this as simple as possible. Just plug in your name and organization, and you can feel free to comment on one or all of the comment areas here, and you'll see at the bottom is the general comment box, and then you just hit submit. But hopefully this will help us help you in terms of triaging and organizing the comments that we get. And then the comments will be posted on healthit.gov sometime after the end of the public comment period. So with that, I will turn it over to Dr. Rucker to close us out.
Thanks, Lauren. We've made a little obstacle course here with the chairs. First of all, thank everybody for being here all day. For the folks online, thank you very much. I think it's even harder to participate in these things online for the obvious reasons. I think we learned a lot today. I think we have some paths and directions on where we need to go as we look at this. I think the field is an evolution. The frameworks reflect, their evolution, and I'm confident we can get to some sort of, more common understanding of it. That is clearly, without doubt, the intent of Congress. So I think it behooves all of us to sort of reflect on that and what we would like as patients, and use that as our guidepost as we go forward. So with that, thank you everybody, and the meeting is adjourned.